Welcome to our program. I'm Tony Noakes.
And I'm Dr. Wendy Walsh.
On today's program, we're discussing information that every consumer of pharmaceutical products and every user of medical devices needs to know. Information you most likely aren't aware of, but absolutely should know about concerning the medications you are taking and the medical devices you may be living with. Side effects that could cause irreparable harm to you or a loved one. Now, in this segment of our program, we'll be discussing potential side effects related to the chemical component gadolinium used in the contrast agents injected in patients who are undergoing an MRI. Wendy, as I understand it, MRI imaging is a commonly used diagnosis method because it provides information X-ray, ultrasound, and CT scans cannot provide. So what issues should our viewers be aware of regarding MRI imaging?
Well, Tony, MRI imaging is a highly effective medical diagnosis tool because, just like you said, it allows doctors to identify certain bodily tissues that are not identifiable when using an X-ray, ultrasound, or CT scan. And it also doesn't involve radiation. The problem, though, has to do with the gadolinium-based contrasting agent that's injected into the patient's veins. This agent helps doctors see and distinguish blood vessels from nearby tissues.
Okay, so what problems are related to this contrasting agent being injected during MRI procedures?
Well, Tony, studies as far back as 1997 and later in 2007 indicate that patients with kidney problems should avoid undergoing MRIs involving gadolinium-based contrast agents because it can cause a scarring condition that can lead eventually to organ failure and even death in some patients with kidney problems. Back in 1997, there was a study where 25 cases reported this specific scarring condition.
Wow. What causes this toxic effect on people who have been injected with this contrast agent during an MRI?
Well, the problem is the chemical component, gadolinium. It can be toxic if not eliminated from the body as quickly as the drug manufacturers promise. This puts the patient at risk of suffering serious injuries. Now, this is especially true of patients with compromised kidney function who, because of their condition, tend to retain the contrast agent in their bodies for a lot longer.
Wendy, that sounds really serious. So what symptoms should viewers who have been exposed to this toxic contrast be aware of?
You'd be amazed at the wide range of symptoms, Tony. The most common are tissue burning, pain in arms and legs, bone pain, stiffness in hands and feet, even cognitive problems and brain fog. Other symptoms might be swallowing and voice problems, low body temperature, even balance problems or swelling of the hands and feet.
That is a lot of symptoms. How soon after an MRI do patients experience these symptoms?
Well, it's different for everybody. Most people with gadolinium toxicity have symptoms within the first month after their contrast administration. For others, their symptoms start within a few days, and for some people, within a few hours.
Wendy, you mentioned earlier there could be life-threatening effects to this toxicity. Can you talk about that?
Yeah, this is the bad news. Over time, this can result in very serious conditions, including hardening of the lungs and diaphragm. And this affects a patient's ability to breathe, and in extreme cases can even cause death.
Okay, so what has the FDA done about regulation of what appears to be a very dangerous medical product?
Well, the FDA has been trying really hard to protect consumers. The first action was done in 2007. That's when the agency added a black box warning to the packaging of their products, and they warned patients with diminished kidney function to avoid MRIs with gadolinium contrast. Then in 2017 and again in 2018, a drug warning was sent to healthcare providers indicating the potential for gadolinium retention, especially in the bones, organs, and brain.
So with all these issues, I assume legal actions are pending.
Of course, this is America. A number of legal actions have been filed alleging patients were not properly warned about the risks associated with gadolinium retention.
Wow. Thanks, Wendy. You know, complications like this are not what you would expect after having an MRI. So if you or a loved one has had an MRI with contrast and suffered any side effects we have mentioned, call the number on your screen now, as you may be entitled to significant compensation for your injuries. Welcome back. We hope you're finding today's program interesting and helpful. And for those viewers who are just joining us, I'm Tony Noakes, and with me today is Dr. Wendy Walsh. On today's program, we are providing information about the side effects of pharmaceutical products and medical devices that most people are not aware of. Information that manufacturers don't want you to know about concerning side effects that could cause irreparable harm to you or a loved one. Now, the area of concern we're going to discuss in this segment of our program is for anyone who has had any type of surgery since 2002 in which there has been a need for blood clot control. So if you or someone you love has had surgery where post-surgery blood clot control was needed, you probably have had a retrievable IVC filter implanted, a filter that has been known to cause potentially life-threatening conditions. So Wendy, can you tell our viewers what these concerns are based on?
Well, these IVC filters have helped people enormously. An IVC filter is a medical device meant to prevent recurrent pulmonary embolisms. In simpler terms, it just means it's a filter that gets implanted in the large vein in your abdomen that returns blood from the lower body to the heart and lungs. And the purpose is to just trap large blood clot fragments from traveling through this vein to those heart and lungs, where there they could cause severe complications or even death. As many as 250,000 patients have had IVC filters implanted annually.
Wendy, when were the problems first reported?
Until 2002, the IVC filter was implanted as a permanent filter and had very few complications. Serious problems, though, began after 2002 when the manufacturer of the permanent filter introduced a new retrievable IVC filter. Now, it was designed for temporary blood clot protection, which surgeons began using, however, as a permanent filter. And shortly after that, problems with the device began to be reported. Proof of the problem is that there have already been thousands of adverse events associated with IVC filters that have been reported to the FDA. But here's the amazing part. Reports indicate that as early as 2004, serious complications with device migration, filter fracture, embolization, and perforation of the IVC blood vein were occurring, but not reported to the FDA.
Oh my. I think it is important to note that if you have had an IVC filter implanted and had any of these side effects just mentioned, I strongly urge that you call the number on your screen right now to find out more information about what can be done to protect you and your rights. So Wendy, major problems were occurring and no action was being taken. Is that my understanding here?
That's right, and the story gets worse. It took the FDA 6 years, from 2004 to 2010, to finally send a warning letter to the manufacturer about recurring complications with the temporary filter when not removed. Then 4 years after that, in 2014, the FDA finally issued a second warning letter indicating the device should be removed within 29 to 54 days after implantation.
Wait a minute, are you saying the IVC filter device was actually on the market from 2002 to 2014 without being approved by the FDA as a permanent filter?
Oh yeah, people could be walking around with these things right now. Based on reports by the FDA, that's exactly what happened. Another important part of this is that estimates indicate that more than 20% of patients who have had the retrievable filter don't even know they have it implanted in them.
Wow. So how dangerous are the medical conditions related to this IVC filter?
The news isn't good. We're talking about conditions such as heart or lung perforation, pericardial effusion, cardiac tamponade, or puncture of the vena cava vein. This is major stuff.
Oh, that's serious for sure. What kind of documentation has there been on the problems consumers have had with these filters?
Well, NBC News, as a result of a year-long investigation concluded in September of 2015, raised serious questions about why medical device maker C.R. Bard Inc. continued to sell and market its IVC filters after it became aware that its filters were failing and causing serious injuries. That NBC investigation linked 27 deaths and more than 300 injuries to failures associated with the Bard retrievable filter.
Okay, that's amazing. 300 injuries and 27 deaths related to the filter, and Bard continued to market the device.
They certainly did. And if that's not bad enough, consider the fact that 85% of the temporary filters have never ever been retrieved. I mean, people are walking around with these in their bodies and don't even know.
Okay, that's really frightening, Wendy. I mean, I assume there have been a lot of legal actions filed as a result of this device, though, right?
Well, there have been. Numerous lawsuits have been filed, and a recent verdict in May of 2018 of $1.2 million was awarded to a man whose vena cava was perforated by an IVC filter after determining that the device was defectively designed and manufactured. In another 2018 jury verdict, $3.6 million was awarded against IVC manufacturer Bard to a woman whose IVC filter broke inside her body, causing her to undergo open heart surgery to save her life. That jury found that Bard had negligently failed to warn the plaintiff and doctors of problems with the device, despite numerous reports of IVC filter-caused complications. I mean, even some doctors don't know. Reports indicate that over 6,000 lawsuits are now pending across the country, and I think a lot more will be expected.
Thanks, Wendy. That is some revealing information. If you or someone you love has had a retrievable IVC filter procedure and experienced any of the side effects mentioned, you need to call the number on your screen now, as you may be entitled to significant compensation for your injuries. Welcome back to our program. For those viewers who are just joining us, I'm Tony Noakes, and with me today is Dr. Wendy Walsh. Our topic on today's program will be of special interest to anyone who has suffered injury due to a medical product or medical device. This segment of our program is about hernia mesh, a medical procedure used in hernia repair surgery. So Wendy, tell us about hernia mesh and problems our viewers who have had hernia mesh surgery should be aware of.
Thanks, Tony. Well, hernia repair surgery is one of the most common surgeries performed in the United States, with over 500,000 procedures performed in North America every year. Hernias occur when an organ, intestines, or fatty tissue poke through an opening, hole, or deteriorated spot in a muscle. Hernias can be caused by many activities that increase abdominal pressure, like obesity, weightlifting, or even pregnancy. Many hernias require some form of surgery or medical procedure, and unfortunately, many people have experienced serious side effects and complications due to the use of hernia mesh to repair a hernia.
Well, that's a lot of procedures affecting a lot of people. How is hernia mesh used in hernia surgery?
Well, the purpose of hernia mesh to repair a hernia is to reinforce and replace displaced tissue for longer-term abdominal wall stabilization. The manufacturers of hernia mesh products claim its use often results in a faster and longer-term recovery compared to procedures using just sutures. Hernia mesh is supposed to work by acting as a scaffold for your body to grow over and through it, effectively repairing the hernia defect. Common types of hernias are in the inner and outer groin area, the upper thigh, or the abdomen.
Wendy, what type of problems have patients had with the hernia mesh procedure?
Well, Tony, the primary problem has been reopening of the hernia when the mesh repair fails. Mesh can migrate or move or shrink and then cause bowel perforations, holes or tears, organ damage, obstructions, and additional surgeries. Now, this is especially true if the mesh product is faulty or contains a polypropylene coating.
So what causes the hernia mesh to fail?
There are a number of actions filed against the manufacturers that claim the product contains a design defect that causes the hernia patch to tear, contract, or migrate after being implanted.
Are there symptoms a patient may experience if indeed the hernia repair has failed?
Yes, there are. If a patient has received a hernia mesh, some of the symptoms to watch for include constipation, fatigue, fever, irritable bowel, severe pain, and urinary issues.
What type of side effects have patients suffered when the mesh has failed?
Patients have experienced a number of serious side effects, including pain, swelling, bowel obstructions, seratomas, or fluid buildup under the skin, infections and mesh migration, or hernia reoccurrence.
Wendy, when a mesh fails, what options does a patient have?
When mesh fails, additional surgery is often necessary to remove the mesh. And in some cases, due to the development of scar tissue, removal of the mesh isn't possible at all, which requires even more extensive surgery.
So with all these problems, has there been a recall of the device in the United States?
Yes, several recalls have been issued, including a 2016 voluntary recall of Ethicon PhysioMesh and a 2013 FDA Class II recall of the Atrium C-Cur Edge product. The PhysioMesh product was also recalled by its manufacturer in both Europe and Australia in 2016.
So with issues as serious as these have been, are there lawsuits filed against the manufacturers of Hernia Mesh?
Oh, you betcha. Yes, lawsuits have been filed alleging that several of the Hernia Mesh products have been defectively designed and are causing unnecessary repairs and injuries that wouldn't have occurred if a substitute mesh product or sutures had been utilized. The lawsuits involving the Hernia Mesh medical devices also allege the products are failing at a rate higher than expected, causing additional surgeries, infections, bowel obstruction, organ damage, scar tissue, and chronic pain. Reports indicate a large number of additional lawsuits are expected to be filed.
Oh, there sounds like some issues there for it to be filed. Have there been any other claims made about the way manufacturers have marketed the device?
Funny you should ask that. Court documents also show that the manufacturers of Hernia Mesh devices have been marketing and promoting the products for unnecessary uses, such as the repair of smaller hernias that could be treated through laparoscopic surgery and stitches.
This has to be really troubling information for anyone who has had the Hernia Mesh procedure for hernia repair. If you or a loved one has suffered adverse side effects from Hernia Mesh surgery, you need to call the number on your screen now. You may be entitled to significant compensation for those injuries. Welcome back to our program. For those viewers who are just joining us, I'm Tony Noakes, and with me today is Dr. Wendy Walsh. Our topic on today's program will be of special interest to anyone who has suffered injury due to a medical product or medical device. This segment of our program is about Assure, a medical device designed as a permanent, non-surgical birth control device used by more than 500,000 American women to prevent pregnancy. Assure has been promoted by its current manufacturer, Bayer, as a non-invasive birth control that is 100% effective with a quick recovery time. So Wendy, what can you tell us about the Assure medical device and the problems related to its use?
Thanks, Tony. Well, Assure is, as you said, a permanent birth control device that was developed by a subsidiary of Bayer. The device is inserted into a woman's fallopian tube by a physician, and the inserts are intended to form a natural barrier that basically keeps sperm from reaching the egg, thereby preventing pregnancy. Assure was approved by the FDA back in 2002.